What are some of the other big levers we want to look at when it comes to metabolic health?
Wow. Well, one that completely caught me by surprise. It was unexpected. I mean, I knew it played a role, but I sort of underestimated the role, and that was mindset and sort of mental approach to things. And it's almost like the future we imagine, how we look at the world, how we envision the future, how we envision our future affects the future we will have. In other words, it's not just about, not being depressed, not having anxiety, which is certainly a big factor. We want to be, we want to be healthy, but I think it goes above just the baseline being mentally healthy. We want to go beyond that and have a mindset of abundance and a mindset of having a purpose in our lives. I mean, it's no surprise that, many people retire or many people die at age 66 in this country. And why is that? Well, that's because they retire at age 65 and they lose their purpose. I mean, what is it? Firefighters, most of them die within 5 years after retiring. I mean, there's some interesting statistics there about purpose. So I think the future we imagine for ourselves can be the future we create. In other words, if I look at older age as a time of infirmity, a time of decline, a time of impairment, it's nothing I look forward to, and there's a good chance it will likely become that for me. If I look at my life as a age of abundance, a possibility of goals I want to accomplish down the road, there's a good chance that will happen. I mean, I used to make not a joke, but a comment about, talking about the phenotypes of aging, all the stuff like wrinkles and, gray hair that we talked about before. And I used to say, well, we could take Botox for wrinkles, right? I'm in Southern California, that's very popular here. I'm obviously not taking it, but I sort of made the comment, well, the sad part is that people who, you could take Botox for wrinkles, but people will eventually find out that taking Botox for wrinkles doesn't make you live longer. It doesn't affect your longevity at a core level. And then began to have conversations with people, and they said, are you sure of that? In other words, and what they were pointing out is that people who embrace youthful vitality, they look at their life as, something happening long-term, and they make the effort to, get the Botox, or they look at life as, powerful, rather than someone looking at it like, I'm dying, I'm going to die, and guess what? One of these days I'll be right. That's true, they will. People who look at it as a chance of empowerment actually may live longer. So people, getting the Botox, and it's about the mindset. I have a friend, I was talking to him, and I said, yeah, what are you doing this summer? He goes, I'm going to Burning Man. It's probably the last one I'm going to go to, though, because he's in his 70s. And I think, well, why? What's going on? Is it you planning on dying or something? And that was sort of the unspoken thing. Well, I'm old. But with that attitude, you are old. You will be old, but if it's like, no, I'm gonna go. I'm waiting. I'm gonna go on my 100th to the burn and do this or whatever festival or event you look forward to. That mindset plays a role, and then I began to ask myself, like, oh well, sure, that makes sense. How could it possibly tie in mechanistically? We're all evidence based, right? We want scientific papers. How can we make a mechanism that ties in mindset to aging better? Well, one thing is stress, right? If we look towards our future life as a life of joy, abundance, accomplishment, and purpose, I'm going to do great things. It may be great things with my kids or my grandkids, or it may be, great things for my charity or my job or whatever I'm doing, but looking towards the future as a place of abundance, it changes the way we experience stress, and stress is affecting our inflammation. Directly drives inflammation, drives insulin resistance, all these things. So how do we affect stress by our mindset? Well, stress is really interesting. This is another wake up call for me that I hadn't thought of before. Is stress is one of the biggest drivers in aging and all these things through inflammation and these other factors. But stress, you ask people what causes stress, is, well, what happens to me in the world? It's the environment, right? I don't get to, pick the political candidates or, pick there's an earthquake or, stuff happens, and it's stressful. Well, that's true, sort of, but it's not completely true. Actually, stuff happens in the world and we don't get to control what happens in the world, right? But stress is not what happens in the world. Stress is how we respond to what happens in the world, how we, you, me, everyone else, individually responds to what happens in the world. And so a similar thing can have a different response. When it starts raining, I could get really stressed out because my nice new clothes are ruined and It's a stressful experience. On the other hand, it's raining, it's warm, it's beautiful, it's glorious. I love it. I love the feel of rain. It's a beautiful moment. Or an extreme example, I have surgery. It's extremely painful. I'm extremely stressed out. The same amount of pain, a similar surgery could be a joyous experience to someone else who's having a baby, a lot stress we get to filter through our expectations, through our view of the world, through the reality that we create, and we get to create it through our mindset. And I think this is really underestimated, and it's really a overlooked opportunity in healthcare and longevity for all of us.
You mentioned inflammation there, tying the stress to health as a whole. Any other ties physiology-wise?
Yeah, I mean the stress. I mean, inflammation is the ground the ground truth on that, but also driving metabolic conditions like insulin resistance, inflammation, insulin resistance, metabolic disease are all interrelated. So I think it drives all of those as well. And just the stress really frames our reality. In other words, if I look at the future and it's very stressful, that's a very dark future, and I'm not happy about it. And maybe I don't want to live that long, On the other hand, if the future is joyous with opportunities, not that everything is happy, but if I look at it with a attitude, a mindset of growth, a mindset of abundance, it changes the way the reality appears, I think.
And pivoting off of stress into exercise, these two are tied together, exercise being a modality we can use to drive down our stress. And also exercise is tied to metabolic health through even walking after meals, putting on muscle mass. So I'll have you bring exercise in and talk about how you use that personally and how people can use that as a tool for metabolic health.
Yeah, exercise is huge. And I want to divide it into two parts. The first is the obvious one, physical exercise. And then if we can come to mental exercise. But physical exercise is really important for all sorts of reasons. Exercise in itself is stressful. So, but it's a good kind of stress, we react to it positively and all. One thing I wasn't aware of that was sort of a wake up call, but maybe it shouldn't have been, is that exercise, like almost everything else we do, there's a good amount and a bad amount. In other words, low amounts of exercise, which most of us fall into, is bad. But there's actually some growing evidence that large amounts of exercise beyond a certain point can be harmful. So it's kind of a U-shaped curve. And the data came in with ultra marathoners, ultra athletes, where they actually have increased calcium scores and they have increased coronary artery calcium out of proportion to their age group or anything that they felt is tied to this the stress of this exercise. But then you may say, well, maybe it's spurious. It's related to calcification, but it's not really heart disease. It's just calcification in the vessel, maybe due to flow or something. But then a darker part became revealed, and they actually have myocardial fibrosis and abnormalities of heart wall function, which is really concerning. So I guess the point is that that there's a sweet spot for exercise. Most of us are not doing enough, but on the far extreme, we need to be at least aware that, we don't want to do too much, certainly to injure our bodies with our joints and everything else, but also there's a basic cardiometabolic factor going on there. So I think, that's important. Resistance training, for osteoporosis, muscle mass for glucose metabolism, just handling insulin, handling all these things. There's so many advantages of exercise and the physical exercise. I think that's huge. The mental exercise is sometimes overlooked with people, but I think it's equally important. What blew me away was that my training is in radiology. So, looking at x-rays and stuff like that. I was blown away by the fact that things like both physical exercise, but also mental exercise could show within a short amount of time, in a matter of months, actually changes in the brain, actual brain growth, presumably related to its effects on BDNF, brain-derived neurotrophic factor, which, certain parts of the brain, like you'd expect, the hippocampus, can actually increase in size with these various activities. So it's really amazing. But so for mental activity, it's not like watching TV or watching a movie, something passive, but ideally it's something active that's engaging your brain. I mean, if ideally you could do something that engages both physical and mental activity, like playing a musical instrument or something where you're, doing both is good. If you're not doing that, I just started doing a language, Duolingo. I can do it on my phone. It's a free app, doesn't cost anything. I do it 5 minutes a day. I'm now at 1,400 days, a continuous streak. And slowly but surely, 5 minutes a day, I'm learning Mandarin Chinese. And what I'm doing, the next level up after, if you're learning a language and you want to up your game, there's so many resources on the internet today. So what I did is I took Siri or my app on my phone, whatever your Alexa, Siri, whatever you use, but I just had it change into Mandarin only. So now if I say, hey Siri, set a timer for 15 minutes, it responds in Chinese. It says, I don't know what you just said. So now it forces me, every time I interact with Siri, I have to do something that I have to, one, get my pronunciation right so that it works. So I say, hey Siri, ding chi chi arsha feng zhong. And now, sure enough, 20 minutes. So there are all sorts of things you can do like that. If you're not into foreign language, obviously crossword puzzles, Sudoku, those kinds of things like that. But mental stimulation, even just going for a walk and talking to your neighbor, engaging in community, engaging in, the blue zones were very popular for longevity a few years ago. And with certain parts of the country, certain parts of the world where people had very long life expectancies, and Dan Buettner popularized it with a TV series, and there were a lot of wonderful things about it. Community, certain types of food, getting together, working in the fields, and they were, but the sense of community, a lot of the other stuff has been criticized recently, like the record keeping probably confused the ages, and that was probably a thing. And then sadly, the whole Blue Zone brand has recently been sold to a group with strong religious affiliation, which has a strong nutritional agenda, which may influence the messaging with that. But I think there's a lot of good things to be said about community and family and social interactions with the Blue Zone theory, but that applies to the brain exercise anyway.
All right, tying in another piece that fits with the brain and with stress, sleep. Let's talk about its impact on metabolic health when we're getting enough and then when we're not.
Yeah, and I think this is a place where the medical profession is so messed up with this because, I, like many people in my profession or many other professions, I used to carry a beeper around, a pager, and I would be on call 24 hours a day, 7 days a week, and I'd get called at all weird hours. My sleep would get disrupted, but somehow I thought I was being tough and I was helping my patients when actually I was probably hurting them. And one wake up call to me in this book was, in researching this book, was that you hear some people like Elon Musk saying, "Oh, I only need 4 hours of sleep a night," and da 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 da. There's a growing evidence that just like for exercise, just like for so many of the things, the cost benefit curve for sleep, for quantity of sleep, is fairly narrow. In other words, it appears that risk of cardiovascular disease and other diseases, all these metabolic diseases that I've been talking about, is a fairly narrow window, around 8 hours, and so maybe some people can get by at 7 hours, maybe some people need 9, but if you need much more than that, or if you think you can get by much less than that, you may be kidding yourself. And sleep, we know directly with sleep deprivation, you take college kids, and there have been controlled studies with this. They sleep deprive them, and immediately their insulin resistance goes up. Their metabolism is messed up. Their glucose is screwed up. There's inflammation. So it directly affects these primal metabolic markers that we're taking. So the wake up call for me was sleep quantity, which really helped. And then the other thing was sleep quality. So, you've got to get the right amount, but it's got to be good sleep. And there are a number of trackers on your phone or different things that you can do to look at that. I mean, an interesting thing happened to me once I began on this path and changed my lifestyle and everything. I noticed that I was sleeping a lot better. I don't know what it was. I wasn't paying attention to it, but I was sleeping a lot better to the point that I didn't need an alarm clock anymore. So I just sort of woke up naturally. And now I figure if I need an alarm clock to wake up, I'm probably not getting enough sleep. So it's fascinating. But yeah, sleep, I think, is another area that's overlooked in our toolkit for metabolic health.
You mentioned trackers there. For somebody who's tuned into this point and, they've taken in a lot of different information, different areas where they're wondering where they're at on this continuum of metabolic health, how does testing fit into this for somebody early on to see where they're at and then ongoing to continue to keep track of their progress?
Yeah, I think testing is key to know where we are on that course. And like we talked about, the earlier the better. I mean, these changes start happening in people's 30s, although these chronic diseases usually don't hit till people are 40 or so, although they're getting earlier and earlier. We're seeing now cancer, colon cancer, hitting in younger and younger populations, and obesity. Type 2 diabetes used to be called adult onset diabetes. Now it's occurring in children. Similarly, hypertension and everything. But so tracking early is good. Some of the markers I would look at is hemoglobin A1C, which is a marker for glucose damage. It's the metabolic marker for insulin resistance. You can do, you can absolutely measure fasting insulin. I mean, I use a panel that I do from I do a finger stick at home. I get about 20 markers. I do it like once a month or two, and it gives me hemoglobin A1C, insulin, LDL, cortisol, testosterone, FSH, homocysteine. It's just a whole thing. And now these tests are getting so inexpensive and so easy. You can even do them from your home and begin to track where you are in this. And it's never too early to start thinking about metabolic health and to live a healthy lifestyle, because we don't know how early these things really start, and the sooner we engage in prevention, I think the better the outcome.
And what's the name of that test you were just talking about, the finger prick?
Yeah, I have it on my website. You can get it from a company called Sifox, Sifox. But I have a discount on my website. It's about, I think it comes out to be about $15 a test or so, but it's significantly less than the Sifox site, but that's who we use, and it's a great one. So either on my website or at Sifox, either one, you can try it out.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
If I put food into my mouth and it goes into my stomach and my GI tract, no matter what the food is, it's going to drive inflammation, because inflammation is the body's natural protection against foreign material. Fructose, when it's metabolized